So this is the first video of potentially this entire YouTube series that we're working on, that one ideally will act as a accent and corollary with the school for our current students that are working their way from entry, very beginning orientation all the way to graduation, to anybody above and beyond. So with no further ado, this is Sandy. And I'm Luke. And we are the instructors at Health Enrichment Center, School of Therapeutic Massage. And the first part always ends up being us having to just introduce ourselves and talk about how amazing we are in our history and everywhere that we've worked. So that's the first part, is I will act a little bit as the interviewer. So now this is also my mother, by the way, so I may go back and forth between Mom and Sandy. But if you could just give us a little bit of a background to how you got into massage and how we even got to the school and the textbooks and all of that.
Yeah, people like that story. I've been at this for 45 years now, long time, and have seen a lot of shifts over the years. But I'm initially self-taught. There wasn't any schools. I became interested in massage as a methodology because I was involved in the holistic health type stuff, and I'm a child of the 60s. So we came out of that into the 70s and started this whole journey in the late 70s. So initially taught myself out of a book called The Massage Book, which is still in print, which is very cool. And then went on a journey, just started practicing. There was no licensing or anything. Then I went on a journey of finding teachers for myself, and had a lot of teachers over the years.
Were there some major highlights that really made an impact?
Yeah, I have two favorites, and this doesn't discount any of the other teachers I've had, but these two made the biggest impact. Dr. Leon Chadow, which I had, who is an icon in the massage world, and I had the honor of working with him in multiple ways for over 20 years.
And Chaitow, that's a Chaitow.
Yeah.
Published a lot. There's a lot of good stuff out there if any of you are interested.
And you had a chance to haul him around.
Oh, he was an amazing wizard-like character. He just had the big poofy hair and incredibly endearing personality, but the knowledge base, because I did get to sit in through it was at least 3 if not 4 of his workshop series when he would come to the school.
Yeah.
And what were some of his? He was a European osteopath.
Yes, correct? Yes, and trained in multiple methods, and he brought a lot of that information into the massage therapy community in the 80s. And so he would visit the school. I would teach with him on the road, and I've written books with him, and he passed a couple of years ago. And I am now with his daughter, Sasha, taking over that series of textbooks. And we just had one come out on muscle energy technique, of which you wrote a chapter for.
Yes. So graduate level therapists, if you're out there, that is a great resource to go look up, is Chaitow's work. And now the continuing renditions of that, but even the classical. Yeah. It's all of enormous value. And who was the other main highlight in your history?
David Girovich.
And I met him too.
Yeah. And you were just a kid.
I was a little one there. Yeah, I wasn't actually learning massage at that time. But I do have strong memories of going and hanging out when I was, pretty small.
He was a Russian medical doctor, and during the fall of the Berlin Wall and that sort of thing, his his son got him out on a refugee status to the United States, and I was contacted to see if there was anything I could do because he couldn't bring his medical license with him. And I immediately realized the value of his background and his perspective, and incorporated him into the school and some soft tissue type practice. And I will always be endeared to that humble gentleman who had so much wisdom, but at the same time danced to tango. He was just, and what I am aware of is how fortunate I have been to have these types of instructors and how they've influenced where I am right now, and you. That generation doesn't exist anymore. And so that's a real solid foundation upon which I built.
That's actually something I've learned to try not to take for granted, is how lucky I have been in the influence of knowing your peripheral mentors, naturally being, your kid, but then beyond that, the other mentors, I look back and I go, the happenstance of stumbling upon those people and building out that frame of reference. So one of the missions I have with trying to get this video series going is to make sure as much of that is offered. I mean, you've written the material and all that kind of stuff, but I really want a lot of the nuances that seem to just kind of dilute things down to just what works.
Yep.
There's a lot of inspirations. There's a lot of cultural, spiritual nuances to so much of this. But there were few people that kind of broke things down in a way that consistently could just be tailored to people and get the responses and outcomes, because it's about helping people, right?
Well,
it's about getting results and helping people. The explanations are great, but it's about finding a way to take all these cool disciplines and get to where people starting out in massage or any manual therapy can just begin to know what process to start with, which is the general full body, but then above and beyond that, the more profound tactics can be from anywhere, whether it be a Russian physician to an osteopath to ancient disciplines out of Asia and elsewhere.
They've all had influence, but what happened starting in the 90s was back in the early 70s and in the 80s, it was really random and individual teachers creating a following and that sort of thing. It was in the 90s that there was an attempt to consolidate and start to look at underpinning mechanisms and try to create some research around that, which has occurred, and so. But
you've really been a pusher for that.
Yes.
So as I'm trying to realize, I digressed, which happens. But when you I'm sure we'll be able to come back to that idea, but you started the school in 1985.
Yes.
Right? We always know that because that's when I began to materialize. So the year right now is 2023.
Right.
We just had a class start in September. So school's been going for,
37 years.
Yeah, we're getting close to approaching 40 years. So from the 80s and then into the 90s, and the push to get away from the specialized systems that really you could only learn from one individual.
Right.
To something more where there was an actual, because there weren't even really formalized textbooks, right?
No, there was one textbook that had really been written as an expansion of some kind of cosmetology out of that publisher. And I knew Mark Beck that took that over, and that book is still available, even though he also has passed. So the concept of an academically produced textbook that was peer-reviewed and research-based was really new. And so the first edition came out in 95, and we still didn't have a solid research base. But as each edition has progressed, and we are getting ready to, this is 7 and 6, and we are currently working on editions 8 and 7 on these.
Those will be out probably 2024-ish,
2025.
This will be different, a new massage therapy review for the exam. Massage therapy exam and review will be out probably 2020.
It's due out 2024, January.
So, new stuff out. These labels that you see will still be more or less the name. This one will have changed. But from 95 to now, this I'm sure has forced one to stay current with the research and structure it. I'm sure having developed the school lended itself to developing the textbook, but also constantly developing textbooks has to help with teaching students in a school.
Yes. Because the textbooks itself are teachers.
Right.
A lot of people don't realize that, but I write, and now you write these as an integral part of the teaching process. And as massage therapy has formalized and moved into general acceptance, it's not considered periphery at all anymore. Very much integrated into an integrated health system. And from the wellness sector all the way through complex medical conditions, working with other medical professionals. You know, we have to function in a different way. We have to speak in a different way. We have to know how to collaborate in a different way. And that is progressed through each rendition of the textbook.
And I think that being the important point is the idea, I would say it's part of the underlying philosophy that we've been pushing, is that massage as part of an integrated health maintenance system. Whether it be an individual working in solo practice, as an employee at a spa, or any other wellness retreat center, anything like that. Not acute, not anything like that, but also medical, sport. And it doesn't mean more often than ever people are seeking out health maintenance, pain relief, mobility focused needs at spas. So it's
and it's a huge there's a huge transition towards wellness and health maintenance.
Right.
And so one of the things that occurred following the research over the years with this was a movement away from individual modalities to evidence-informed outcomes, and those outcomes being incorporated in a variety of environments. And my goodness, we've been there, done that.
And you'll hear these outcomes again and again. So we got relaxation.
Yep.
Stress management.
Yep.
Pain management. And mobility.
Yep.
So the principle being, what is your scope of practice? Manual therapist. Manual therapist, massage exists in that umbrella, but there's lots of manual therapists. Physical therapists can do manual therapy. Chiropractors do manual therapy. Osteopaths do manual therapy. The question is, in your scope of practice, what can you do to achieve one of those results for a client? And it's now there's going to be a mix, of course. Stress management and pain management go together. Pain management, mobility. Usually it's more of a soup than anything, but that ends up being one of the big hallmarks, I feel, is the idea of going away from modalities and cookie cutter-esque routines, but thinking to be inspired from many systems and think about what is the outcome that we're trying to achieve for the client.
Well, and you always have to start with tools, right?
Yeah.
And so, how do you create a certain effect on the soft tissues? You push, you pull, and I'm sure we'll explore this when we get more into the mechanics, but it doesn't matter what the modality is or what it's called, be it myofascial release or Swedish massage, which is a unique system, or
really should be called classical.
That's right. Yeah. Classical massage. There's still the underlying focus is mechanical force application, and currently the National Institutes of Health is putting a lot of research effort into what they're calling force-based manual therapy and the mechanisms. And I was involved in the International Consortium of Manual Therapies as part of that development and terminology and things that went with that. And it's been a long progression, many years for the massage therapy community and the interdisciplinary communication to grow up a little bit. And we still have problems. Like we have worked, oh my goodness, in the early days of the school, we had educational partnerships with professional sports teams.
Yep.
We had them with the VA hospital before that was even a thing.
Yep.
We had them with hospice.
So there, you did develop an integrated construct of massage in the healthcare setting.
Absolutely.
And I was gifted the experience of going and functioning in those clinical spaces for years. So there's that. There was college sports.
Yeah.
University of Michigan. There was NFL.
Yeah.
And then you worked a lot with NBA and NFL players.
Pro golf.
So lots of athletes, lots of medical, there's sports, medical influence, but then there was also student clinics and now even a spa setting. So
yes.
And we function together in developing. It's not in existence anymore. It was the Alliance of American Football.
Yes.
But constructed a league-wide. We were the directors of massage therapy, but a league-wide contingent of massage therapists. Over 100 massage therapists coordinated across the country for this entire league. And although it only lasted a year, boy, it worked. Our our system worked. The finances on the back end for the whole league didn't work. But between that and we're kind of jumping around, but that's okay. My coming out of the school, this is a little bit of kind of dovetailing in our experiences and what kind of makes us special.
Yes.
But coming out of graduating from the school and having those clinical experiences, I then was set up in such a way where I functioned predominantly with chiropractors, but then ended up having a touch of your clients become your own teachers.
Absolutely.
And once you develop a network of trust with even other healthcare professionals, although we think of integrated systems having to function at a hospital, what happened for me is surgeons and physical therapists became aware that I knew how to work with joint replacement and joint surgery related stuff. So I worked a lot with joint replacement, and then above and beyond that, the entry into this experience was from some of our shared contacts because of the athletes that we had worked with. But then I ended up working in the NBA for 11 years. One, traveling full-time as the person. I continued to travel, but then eventually built a team of therapists that function for the team.
Yes.
And that's, some of the people are still operating down there, for example, but the experience has been such that between the two of us, we've worked in these spaces, in these integrated teams, and we've built and facilitated managing and coordinating therapists, teams of therapists in these arenas. And then even now, a spa directly attached to the school.
Yes. A
which
franchise.
Which we built from the ground up. I run desk. You have a little bit too. Learned all of the ins and outs of the business side of starting something from the ground up. And then now the students also get at least that granted experience of being able to drop shadow and see all the stuff in operation.
Well, and to be, I've been self-employed most of my career, as you were, but and then you were an employee for the Pistons.
Yep.
And then becoming employers.
Yep.
And the wellness sector, of which the franchise system for massage therapy is a huge player, and a major employer of massage therapists. It was, if we're going to be major educators, then I felt we needed to understand what it was like to work through that. And it gave me a whole different perspective on the value of creating these environments where excellent owners can support the development of excellent massage therapists. And I still work in a consulting factor with all of that. And we still fold laundry.
Yep. A lot of laundry. Every little bit helps. But coming into a bit of the continuum, you had, with the school and other arenas, become a little bit of a person of influence. Elsevier found you developed the textbooks, starting with fundamentals, and then there was essential sciences, and above and beyond. There were a few others.
There was a sports massage book, and a clinical massage book.
Healthcare one. These three will be the main ones that are out there. But you have been a person trying to nudge the field in the direction, even just of basic state licensing and stuff like that.
Yeah.
So it lends itself, I think, uniquely well in that the writer of the textbook, who also, in the midst of that and prior to it, was thinking from a massage education standpoint. You had the school, you wrote the books, and the books are integrated directly into the school. And ideally, more systems would do that. Sometimes it's not the case, but the idea of, having, including sciences, an anatomy textbook that's more for manual therapists.
Right.
Things like that. An awareness on your part for all the multiple choice question related tests that we have to take. There used to be national certification, which wasn't mandatory. Now almost all states have a state licensing exam that you need to do.
And it's the MBLEX.
And you've been a part of that.
Yes.
Thus, it's another example of, one of the important points in massage education is you have to, go through all the steps, but you do have to get licensed.
Well, and, I've been around long enough so that I've lived most of the history, most of the current history. And there has been a shift in how massage therapists practice. And we need to be looking forward. We need to always be aware of the past, but we always need to be looking forward, especially in the educational materials and how we develop our own curriculum. We need to train to the future. And the textbooks, unfortunately, in some educational systems are underutilized.
Yes.
And there's so many other ancillaries that go with the books, and we're hoping that these series of videos that we're producing also gives guidance and help, not just to our students at Health Enrichment Center, but
across the community, worldwide if possible.
Yes,
If we can create ripples, that'd be great. Something that she said, like, now this is specific to Elsevier, but there's an Evolve online component with a lot of accessory elements to help people learn. But as she said, regardless of where you're at, if you're somewhere else learning in different systems, then delving into whatever texts are presented available to you, but looking and branching out into other texts and letting them guide you is important too. But and coming to a little bit of wanting to, I guess, try to wrap this.
I think we should.
We introduced ourselves and we talked a little bit about, but to bring it more about the school specifically, it's, if you want to learn more, healthenrichment.com. I didn't have enough room for the .com. I thought about writing it in, but Health Enrichment framed up so well. It was, but look, Health Enrichment Center School of Therapeutic Massage, healthenrichment.com. Here are the books: Fundamentals of Therapeutic Massage, Essential Sciences for Therapeutic Massage. It will be massage therapy exams and review.
Right.
Yeah. But through Mosby.
Mm-hmm.
And we start our classes every spring and fall.
Yeah.
12 total students. We don't want huge classes. We have a unique experience in our system that you and I are with them from beginning to end.
Yes.
So the entire pathway. And it's understandable that other systems may not be able to facilitate that. But regardless, the hope is that all of this will help massage therapists
and massage teachers
be better.
Yes.
Yeah.
And more confident.
Yes.
And that we focus succinctly on foundational material and skills, because advanced work is experienced use of the basics.
Right. And I think actually that brings back to another one now I'm remembering. That it's important to always be your own best teacher.
Yes.
You had the experience of you went out and learned from lots of people.
I did.
But ultimately you became your own best teacher.
And that's important, and that's what we focus on too.
Yep. We want to create resources, the books, these videos, everything else, that lend themselves not to just saying be a clone.
Oh, absolutely not.
I strongly want to always remind people that keep looking, keep researching. It can be an ancient discipline. It can be a brand new thing with a new name that you'd find out is just a rediscovery of something.
Yeah, that's not a lot of new stuff.
Be your own best teacher. And another really important element that I think makes us especially unique is our focus on good ergonomics. It seems so simple, but if anybody out there, it won't probably blow anybody's mind, but it's incredible how little focus there has been on good ergonomics for a massage therapist for doing massage, so that they use their body the most efficiently possible. One, so they protect their body and don't hurt themselves doing massage, but so they can also give better quality care throughout an entire day of practice. And then, everything from ideally the clients have better outcomes, but also a therapist able to do enough massage to help more people and actually make a living.
Absolutely.
But ergonomics will be a big point that we focus on for our students. And if I have another key thing that I hope we make a ripple effect on, it's that all of the massage community, if you take any one key thing out of any of the demonstration videos that we show, it's the ergonomics.
Yes.
And multiple positions, moving the client, sideline position, as well as prone and supine. Simple things like that. So.
Because you can't hurt yourself to help somebody else.
No.
And you don't have to.
No. Oh, I think that was excellent.
I think so too.
So nice to meet you all, and we'll see you on the next video.